Have you ever wondered why some people lose weight quickly on medications like semaglutide or tirzepatide, while others struggle to see any results at all? Today, I want to demystify what these new weight loss medications really do inside your body and help you figure out if they're right for you. I'm Dr. Lori Smith, founder of Vitality Telehealth. In my practice, I've seen these medications change lives, but only when they're used the right way for the right people. There's a lot of confusion and even hype online about these medications. Let's set that record straight with real science and practical advice. For example, I had a patient struggling with their weight for years, even with strict dieting and exercise. After I determined if she was a good candidate for semaglutide and created a full support plan, she lost over 20 pounds in just a few months. And more importantly, was able to keep it off. So what are these medications and how do they work, you say? Let's go into that. Semaglutide and tirzepatide belong to a class of medications called GLP-1 agonists. I think it's easier to remember GLP, and that stands for the gut, the liver, and the pancreas. G is for gut. It's going to work on the gut by slowing gastric emptying, meaning you feel fuller faster and you stay fuller longer. L is for liver. It's going to help suppress your glucagon, which is the body's storage of blood sugar inside the liver. And P is for pancreas. It's going to help your body's insulin production and insulin sensitivity to maintain a balanced blood sugar level. And here's what that means for you. When you take these medications, your brain receives messages from your stomach that says, I'm full. For many people, this translates into eating less, staying full longer, and losing weight, sometimes for the first time in years. Also, no high or low blood sugars with these medications. They really stabilize your blood sugar level. But these medications aren't a magic solution. They work best when combined with healthy lifestyle changes, and most importantly, when they are clinically supervised and tailored to your unique needs. These medications are typically considered for people who have a BMI of 30 or higher, or they have a BMI of 27, plus a weight-related health condition like high blood pressure or high cholesterol. People who've tried traditional weight loss medications or methods without success. I had a patient with high cholesterol and a BMI of 31, and he was unable to take a group of medications for high cholesterol called statins. These statins caused him to have increased joint and muscle pain. We both knew that if he could achieve 5% weight loss, he would improve his cholesterol levels and reduce his risk for heart disease. Now, this patient was working out 3 to 5 times a week and eating a healthy, low cholesterol diet. Within 3 months of starting a GLP-1, he was able to have weight loss of nearly 20 pounds, lowered his cholesterol back into the normal range. While he smashed this goal of a 5% weight loss, he also had more energy, wearing a pant size he hadn't seen in years, and his improved confidence was noticed by his friends and family. I think the best result was the return of his happiness. This is just one of the many weight loss journeys, and there are many more that are just as life-changing. I had another patient who had been obese for so long as she could remember, and now her blood pressure was high and uncontrolled, even on 3 medications. Her cholesterol was on the rise despite being on medications to prevent it. She was working out and eating a healthy diet, but her weight loss journey was going nowhere. After starting a GLP-1 and following my weight loss plan, she started making progress in her weight loss. 6 months later, she was down 60 pounds. This is an amazing achievement. And for her, it wasn't just about the numbers on the scale, but it was that she could cross her legs for the first time in her life. Like any prescription, these medications have potential side effects, most commonly nausea, vomiting, digestive upset, or mild headaches. Rarely, there can be more serious side effects, which is why close clinical supervision is key. I always make sure my patients know exactly what to expect, how to manage the side effects, and when to reach out if anything doesn't feel right. If you've been frustrated by slow progress and want to know whether medications like semaglutide or tirzepatide could help, I'd love to talk to you. Click on the link below and schedule a consultation. I'll review your full health history and help you figure out if this is truly the right option for you. And if you found this helpful, subscribe so you don't miss the next week's episode. I will share the most common mistakes people make when starting weight loss medication and how to avoid them. Thank you for watching, and I look forward to helping you on your journey to better health.